I'm Rabbi Jessica Zimmerman, Graf, and I want to welcome everybody to Congregation Shereth Israel. It is our tremendous pleasure to have Mayor London Breed with us today, a woman who really needs no introduction to any resident of San Francisco. You've kind of become our hero in these last crazy months, and I want to thank you so much for being with us, Mayor. Before we begin, I just want to thank a couple of other people also. Eric Sapphire, who is our longtime devoted congregant who helped us initially to connect to you, and of course Michael Pappas, who we both know really well, who's the executive director of the San Francisco Interfaith Council. It is as a member of the board of the Interfaith Council that I had the privilege to speak at your Interfaith inaugural service. And I was so honored to be there with you and to celebrate your official coming into the role that you play now. So I want to begin by saying I was so inspired by your clarity, your vision, and your faith at that service that you demonstrated to us as you began your official tenure for the city of San Francisco. And I was also loving seeing your smile and your dimples. See, we are sisters in dimplehood. So I'm especially happy to have you here. I'll tell you that when I had a sonogram for my almost 6-year-old daughter, we saw a dimple actually in utero. So
oh, wow.
It's important. So as a native San Franciscan, from me to you, another native San Franciscan, I want to invite you to share with us some of your thoughts from this really challenging time in our world and in history. And I would love to hear from you first. What does it feel like to be mayor in this time? And what in your life do you think prepared you to take on this role now?
Well, first of all, Rabbi Graf, thank you so much for inviting me here to talk to you and the rest of the congregation. It really is an honor to be here and also to serve as mayor of an incredible city. And as you know, and maybe some of the folks who are joining us here today, I grew up right down the street from where your congregation is on Eddy and Laguna in public housing. Some of you remember, those of you who are native remember the Pink Palace. I grew up in the projects right across the street from the Pink Palace. And back then, as we all know, it was no walk in the park. There were a lot of real challenges. And my grandmother, she raised me and 2 of my brothers. There's 6 of us total, but there were a lot of issues in the community back then. And there was also a lot of poverty, a lot of hopelessness, a lot of frustration, and a lot of despair. And the good news is my grandmother, she was spiritual. She was a praying grandmother. And we actually attended First Union Baptist Church on Webster and Golden Gate, where I was baptized. And I was forced to sing in the choir. I was forced to go to vacation Bible school. I didn't really understand what all of those things meant at the time, but I understand them now, especially more than ever as an adult. I remember my grandmother talking about the depression and the need to not waste food and the need to be ready because anything could happen at any given time. And just really talking about history. And in my mind, I'm like, Mama, none of that could ever happen, right? And you know, this is back in like the 80s, the 90s. I'm like, we're gonna be okay. And you all remember the '89 earthquake and what happened back then in San Francisco. And we saw a number of buildings that collapsed. We saw a number of people who were injured, and sadly in the Bay Area, a number of people who lost their lives. But I gotta tell you, I never, and I'm sure everybody on this call, never thought we'd be living through a pandemic, especially in light of, you know, how advanced medicine is nowadays. With all of the number of hospitals in San Francisco, the access to really incredible care, the research, everything that exists in a place like San Francisco, never did we think in San Francisco or even in this country we could be in a place like this. So it was hard to believe, but that the information I had received from our public health experts when we were first told about this, I never thought it would reach not only San Francisco, but our country in this capacity. And so right now, first of all, it doesn't even feel real that I'm mayor, because again, growing up in some of the most challenging of circumstances and being afforded such an incredible opportunity, I still can't believe it every single day that I wake up that I represent San Francisco in this capacity. And it really is a blessing. But the other side of it is, I can't believe that we're also in the midst of a global pandemic. And what I try to do, and I know this congregation would understand it more than most people that I talk to, because I am a spiritual person, I pray. I pray and ask for guidance, ask for the ability to do the best job for the people of this city in all the decisions that get made. Because everything that I do has a direct impact on all of you and others who are counting on people like me and others who are leaders in San Francisco to make good decisions in order to keep you safe. And we have seen the numbers in San Francisco not be as bad as in other places, but the fact is we still have had 52 people who have died in San Francisco from COVID-19. And we know that there's still a lot of work to do. So I am really grateful to have this opportunity. And every single day when making these decisions, it's about what is in the best interest of the people. And my spiritual guidance helps to see me through this process. And also I know many of you, because I hear it from so many folks all the time, I know that many of you are praying for me. You're praying for the city. And our ability to do what's necessary in order to protect all of us. And so I'm grateful for that. And just know that that is really what gives me the strength I need in order to make the right decisions for San Francisco.
Thank you. As a faith community, we are definitely praying for the leadership and the wisdom and the patience that you need to have to continue to guide us through this pandemic.
Pray a little bit more for that patience, because sometimes it's very thin.
Well, it's hard to keep that up right now, I'm sure. Let me ask you, you had mentioned that our death rate is relatively low, and we seem to be doing some things well. Why do you think our death rate is low, and what do you think our successes are here in San Francisco in the midst of this global crisis?
I think our death rates are low because we responded fast early on. We made some hard decisions around reducing the number of events and then doing a complete shutdown in San Francisco. I think that had a lot to do with preventing what could have been a lot worse, as we saw in places like New York, for example, and even in places in the South. We saw not only the cases surge early on, we also saw the death rate surge. But you notice here in San Francisco, in the beginning, we were seeing an average of maybe 30 new cases per day, and it started to decline, and we started to move forward with reopening efforts. And then later on, just recently, where we had to put a pause on our reopening efforts, we're seeing an average of 70 to 80 new cases a day, which is more than we've ever seen. And I think part of the reason that is happening, it's a number of reasons. We're tired of the virus, but the virus isn't tired of us, right? The virus doesn't just go away because we're tired of staying home and wearing masks and doing the things that we need to do. We know that the things that we're asking people to do for this long period of time is something that they're going to also need to do even longer. And I think human behavior sometimes kicks in and people get a little bit more comfortable. But the fact is, I think we're doing well because most San Franciscans are taking it seriously and everyone's doing their part, but it's really been hard to sustain. So I think that's why we're seeing a change, and we're starting to see the curve really go up. And we haven't seen the death rate increase as dramatically. And again, that goes back to, we have an incredible healthcare system in San Francisco. UCSF is absolutely amazing. General and the people who are caring for those with COVID are wonderful. And I think that also plays a role in what we're seeing in San Francisco as well.
Do you know that my husband's a doctor at San Francisco General? Did he email
Oh,
you?
well, he's doing an incredible job.
So many frontline workers. We're so grateful for the work of so many. Are we better equipped now to deal with a resurgence of this, or in some way another wave of infection than we were in March? What have we learned from the first closing, and are we ready to handle whatever comes now?
I will say that we're still, believe it or not, dealing with the challenges around PPE, personal protective equipment. And we are lucky that we have UCSF in particular, and our partnership with UCSF, which has provided an opportunity for us to share resources. So we have our supply, but we are not where we should be, but we are in a decent place, which has been okay. It's better than it was in the beginning. And we are increasing our testing capacity, but the turnaround time for test results are problematic, although we're able to do a lot more testing than we've ever done, and we've increased our capacity here in San Francisco. It continues to be a challenge. Yes, we're better, but we have to be better than what we are right now, because we are going to be living in this COVID world for anywhere between 12 and 18 months. And we also want people to be able to get tested and to get a response as quickly as possible. And even if you're tested negative, it doesn't mean that you're immune from catching the virus in the future. So we do have a lot more work to do, and there's much more that we continue to need, and we are in an okay place, but I'd like to see us in a much better place than we are right now.
Do you see us getting off the watch list? Do you think schools will be able to reopen? What do you imagine might happen?
Well, right now, when we look at the numbers, last week were an average of 90 to 100 new cases a day. Now we're at anywhere between 70 and 80 this week. And that's still a lot for us, because this is not something that was happening before. What we find from our contact tracing efforts, which we're able to reach out to over 80% of the people associated with those who are positively diagnosed. And that's really high in comparison to other places. But again, it's still not enough. But what we found are, in most of those cases, people who are testing positive are those who are getting together with family gatherings and events and picnics and things like that, when they're coming in close contact with one another, and they're hanging out for extended period of time, and they're next to each other. They're not wearing masks because they might be drinking or eating or doing things that you do when you're hanging out with your family, right? So the things that we take for granted, the things that really honestly give me a lot of life, is being around my family and friends, are things that are most problematic. And the other thing that's been problematic are the people who have to work, and a large part of our Latino workforce, and they live in close quarters. So that's been a real challenge. And I think what too is, with our Chinese community, we're not seeing a surge because I think there's a culture of mask wearing and a culture of understanding, that this situation is something that is real, and it's just something we need to do. And I think we have to start getting people's behavior used to something that we're not used to. So until we get to a better place, which I don't see happening anytime soon, then, when I think about the family members who are in Laguna Honda who can't see their family members, or the kids who can't go back to school to learn and to play with their friends, some of the basic things that we need in our lives in order to just really get through this pandemic, those things aren't going to happen until everyone plays their part in just the mask wearing, the hand washing, the socially distancing, and just, we got to get used to that and incorporate that into our lives. And last but not least, I'll say, we all are used to a schedule. Right? We want to know tomorrow, we get up at 8 o'clock, we go to work, we do what we're going to do, or we have an appointment. We are going to have to get used to not doing that, because with COVID, there's so much uncertainty. So tomorrow you may have plans for one thing, and because of what we may have to do in order to keep the public healthy and safe, that may change. So it's going to require us to change our behavior overall if we're going to get to a place where those things can happen, where we can open up and kids can go back to school and we can begin to come together again.
So would you say is the best thing that we can do is to follow the guidelines, all of us? I mean, by wearing masks and hand washing, the things that you're mentioning? Is that, is that what we can do to help?
And here's the thing, because I know many people want to see their family members. But if you're able to visit and you have a backyard and you're able to socially distance or wear a mask or what have you, that's important. When you go to the restroom, wash your hands before you use the restroom if you're around other people, and then wash them afterwards. And just being mindful of things that you do, things that you touch, wearing a mask on a regular basis, and not taking any situation for granted. So I think those are the kinds of things that could be very, very helpful.
Great. Let me ask you, we have a large homeless population in San Francisco, and there are a lot of challenges with keeping people safe and healthy and housed, or at least warm and taken care of under normal circumstances. And now during this COVID time, it's particularly challenging. So I know that there have been some areas for tents set up. And we had a question that came in earlier this week from one of our members, Dr. Jim Davis, who was asking about how you make the choices of where the tents would be placed. How do we find safe housing or dwelling spaces for people who are required to shelter in place even without a home, while keeping the population at large safe also from a big COVID spread? How do you do that?
Well, what you may remember early on in one of our shelters where there's congregate living spaces, there was a big outbreak. And that's really the extent of the challenges that we've had around any other outbreak with our homeless population. It's not to say that people who are homeless have not contracted COVID. It's just they have not contracted it disproportionately in comparison to other populations in San Francisco. I mean, the biggest challenge we have in terms of who's contracting COVID is really the Latino community. Almost 50% of the cases in San Francisco, and even with the hospitalizations, sadly are people who are part of our Latino community. So I think what we did to set up our sanctioned tent encampments had a lot to do with the ability to try and get the problem under control. Our shelters closed. Sorry, it might be loud in the background.
Okay.
Because my windows are not, they're not double pane, so. Our shelter system closed, and we opened up some hotel rooms for some people based on, what we were going to be able to get reimbursed for and what we could afford without, exhausting our budget. We set up these encampments, and just yesterday, I'm not sure you heard, but I released a plan around homelessness and how we are going to make sure that those few thousand people that we have been able to get off the streets into hotel rooms, the people that we've gotten into housing, permanent supportive housing, we have a plan to make sure that those people don't go back onto the streets. We have really done a decent job with the Tenderloin in particular. I don't know if you have been down there recently, but it got completely out of control at one point, and things are getting better. They're improving because of the work we've been able to do. I will tell you that it is really expensive, and some of it is not sustainable financially for the city without diverting other resources from other places, which is also very difficult. But we are doing our very best, and we plan to put the board and I worked to put a gross receipts ballot measure on the ballot to unlock some of the homeless money tied up in litigation and some other resources that will hopefully provide us with the additional support we need to expand our capacity to help people get off the streets and into permanently supportive housing. We're also working with Tipping Point, where they have rented a number of, identified a number of places all over the city in order to transition people into permanent housing. So it's an ambitious plan. It will take place over the next 2 to 3 years. And our hope is that we'll be able to transition 4,000 people into placements in our shelter system, permanently supportive housing, as well as housing. But I want to be clear, it is challenging. It's challenging because of people who struggle with mental illness and behavioral health. And we have a working group, and I know the city attorney is working on this as well, but we are going to have to address the open air drug dealing differently than we have before, because that's part of the problem. And with the behavioral health challenges, we are going to need something on a statewide level in order to be able to force people into treatment, which gets a little uncomfortable when you talk about taking away someone's rights to make decisions for themselves. And I want to be clear, it's not as if I take that ability lightly. I do see a lot of people who are out on the streets, who are completely not in their, the right mental capacity, where they are exposing themselves, whether they are in some cases getting violent. And I'm sure you heard about that 92-year-old man who was killed by someone who was mentally ill in, I forget the neighborhood, but it just happened in Raphael Mandelman's district. And it was, people had reported him, they were concerned about his behavior, but it didn't rise to a level of a crime. So because of the laws, there was nothing we can do. And I think that we're going to need to change some things with our state law in order to be able to help people struggling around behavioral health challenges. So there's not a one thing that's going to fix this. There's going to be a number of things that will need to be done, and I'm committed to it. But I got to tell you, this pandemic has really set us back considerably, financially, and a number of reasons. But it's something that I'm committed to, and we're going to work hard to try and make a difference around homelessness in San Francisco.
Great. So in the midst of this pandemic, there's also been a national and an international interest in addressing some of the issues of racial injustice that we've seen. And I want to ask you, I read your interview in SF Gate and in Vogue, and I know you've had a lot of responses to what you're seeing happening around us. What challenges do you think we particularly face in San Francisco with regard to racial justice, and how might we be better positioned to be able to make a change here?
I think part of what's important is to acknowledge that there is a problem. And you have me as the first African-American woman to serve in San Francisco, and folks think, wow, San Francisco, is this incredible city, is this liberal city, and you think because I'm Black that, the African-American community here, for example, in San Francisco should be okay, but it's not okay. 40% of the people who are homeless are African-American, but African-Americans represent less than 6% of the population. When you look at some of the incredible changes that we've made to police reforms around use of force over the past 2 years, there were only 3 use of force cases involving a shooting with a police officer, and none of those resulted in a death. But then you look at the data, and about 50% of the people who are pulled over or stopped, by police officers are African American. You look at the disparities that exist even in San Francisco. And what that means, as far as I'm concerned, is there's something that we're not doing right for the African American community. Because someone like me, who came out of poverty, who came out of the most challenging circumstances, it's not normal for someone like me to even go to college. And so I should not be the exception. I should be the norm. So how are we as a city going to make changes to our policies to invest and to support and to uplift this community in a way that will help people succeed? And so we are now having these kinds of discussions in the city. We're having discussions around the budget process. We're having discussions with the community directly to figure that out, because there have not been real discussions in the past. There have been conversations with various organizations separately, but never where you had, this uprising and this strong interest in making real change. Even our Police Officers Association, when I proposed my changes to the department and who they respond to and how they respond to things, they're even open to the idea of making some changes. So it has to be our willingness to come together and to talk about the hard things that we need to talk about, and be willing to be open-minded about solutions to some of these problems. So my budget that I will be introducing on August 1st, I think I may introduce it at the end of July because August 1st is on a weekend, will reflect that. It will reflect the need to invest more and to support and uplift the African American community in ways that hopefully will make an improvement to the conditions of this community in San Francisco. So I think that's going to be important. And I think it's also going to be important for us to have honest conversations, because, we all have our own very unique experiences, and how we come together as a community in order to help support one another is important to me. And here, again, as an African American, I have those experiences, but I also understand the need to make sure that we are taking care of all people of San Francisco, and that we are also lifting up communities that disproportionately have been pretty much left behind and not supported in ways that have helped those communities to thrive. So those are some of the things we're going to be working on, and I'm really excited about the future, because I also feel there's a sincere desire from so many people in this city to see a change. And so I think that's what's going to make a world of difference.
You are an incredibly busy woman, and I want to be respectful of your time. I want you to know that we have been a Jewish congregation in San Francisco since 1851. We are very proudly at the center of life in San Francisco, and we are here to help in your incredible work in building a better city and a more wonderful, just place for all of us to live. So just in closing, I want to ask you, is there anything that you can think of that we can do or be aware of that would be helpful to you? And if it's not something that you think of this moment, I want to leave you with the idea that we are here to help and serve you as you serve our community to build San Francisco.
Well, I would say a couple of things that would be helpful. Number one, continue your prayers, because we need it more than ever, especially, it is heartbreaking that I know congregations can't come together right now. And as soon as it is possible, I will make sure that we support allowing congregations to come together as soon as it is possible for people to come together once we're given the directive, because I think that's important. I also think it's important that you're able to support one another, because, for example, there may be people who are a part of the congregation that may not have family members or have support. I'm sure you're probably already doing that, but looking out for one another. And then, some of the food programs and other things that you are all doing already, many of the things that you are already doing are helping San Franciscans, looking out for one another, looking out for your neighbor, helping to support each other, not just in the beginning, but just for the duration of what we're going to be living with. Those are the kinds of things that help us, because when you help people of San Francisco, you help San Francisco. And so those are the things that are important to me. And last but not least, I know that there are a number of people who probably have sent questions or comments in the chat. We do have someone from my team that is joining the call. So I want to be able to make sure we're responding to some of those questions or some of those comments. So we will, Rabbi, if it's okay, get back to you later and provide that information so that you can share with the congregation. That would be really helpful for us to make sure that we're responsive to everyone. So that's it for the most part. And also, please be patient with me. And just know that part of why I do this job is because there were people who took care of me. And some of you know my story. You know I lost a sister to a drug overdose. You know I have a brother who's incarcerated. And I was raised by my grandmother and never knew my biological father, and grew up in the most challenging of circumstances in poverty in this city for over 20 years of my life. And the fact that I'm here, it's an opportunity to do something for people who are in similar situations. And this is what I care about. So it's not easy. It's definitely not easy. But it is my sincerest desire to really make a difference in San Francisco. And if you have questions, concerns, or needs, or suggestions, or ways in which you can participate in any capacity, I welcome the opportunity. So thank you all so much for inviting me. I really appreciate it.
Thank you so much. We will be happy to disseminate answers to questions. There are so many wonderful questions, and we could talk to you for hours and hours. We very much look forward to welcoming you to the most beautiful synagogue in America just as soon as we are able to do that. So until we see you in person, I wish for you, and we will pray for you, that you go from strength to strength as you lead us in this challenging time. Thank you for being one of my heroes. Thank you for being with us.
Rabbi. I appreciate it. Bye, everybody.